Okay, hey, Heather, tell us about the subsidies and who qualifies and what happens if you do qualify and what happens if you don't qualify.
Right now, people between 100 and 400% of the poverty level in the United States, based on their family incomes, do qualify for subsidies on the exchange, and they go upwards with, the more, obviously, the more money that you make. The current poverty level for a family of 4 is $94,200 a year. So any families that make under that amount are going to be eligible to have the government pay for a portion of their health care premiums.
Wow. And so what's the bottom dollar amount? I mean, what do I have to make a year to qualify for subsidies?
I believe for an individual it's $15,000. I don't know that figure off the top of my head, but it's about $15,000. There's if you go online or if you ask somebody that I don't have my papers in front of me, but there are federal poverty level charts that you can search for,
Yeah.
And they will tell you what the baseline.
And
level
are there
is.
people that aren't going to qualify for this Affordable Care Act?
Unfortunately, yes, there are. In the states where the Medicaid expansion was not done, North Carolina being one of them, in order for you to qualify for Medicare or Medicaid in the state of North Carolina, it's 49% of poverty level and below qualifies you for Medicaid. So right now, the people between 50 and 100% of the poverty level line here in North Carolina are not going to be eligible for subsidies on the exchange. So basically, if you make $20 too much for Medicaid, you're going to make a couple $1,000s too little to qualify for any health insurance subsidies and help in that sense. However, you will not be subject to the penalty either. You will get a waiver. The last thing that I saw was that in 2015 they are looking to have a plan that gaps that. That fills in that gap for people that fall into there, but for right now, no, there's nothing.
Now, let's just say I make $200,000 a year. I'm self-employed. I'm in great health, and I've never needed, health insurance. I don't really go to the doctor. What's going to happen to me if I don't buy a policy?
There are penalties if you do not. Basically, what's going to happen is at the end of 2014, your insurance company is going to send you, much like a W-2, that's going to outline your coverage for the year, and they're also going to supply that to the IRS. So employers who offer group plans and things like that will send their insurance information, which will then be audited against tax returns to make sure that you've had it. If you haven't, you will be fined. It's $95 or 1% of your income for the first year, and it goes up after that. 2015 is 2% and $675, I believe, and it goes up after that, and then we'll eventually adjust with the cost.
So you're saying I'll get it, making $200,000 a year and without health insurance in 2014, I'll get a $2,000 penalty from the IRS, from the government, for not having health insurance?
Yes.
Wow. That's something to think about, people. Great, Heather. Thanks a lot for the information.
Not a problem.